Hi, Dr. Fraga here, and last week we announced that we are pregnant with baby number 2, and we are very excited. A little bit about my background: I am a chiropractic and naturopathic doctor, and I also practice acupuncture. A large part of my practice is treating women throughout their pregnancy, and we are very blessed to be a part of that. It's a very exciting time. So we thought it'd be fun if we followed my pregnancy week by week and talked about things that come up during pregnancy, questions that women commonly have, and then also different treatment options for common complaints as well too. Obviously, I'll be taking more of a natural approach with my background. But if there's ever any questions or anything, please feel free to drop comments, or if you'd like us to cover a topic, we'd be more than happy to do that. So like I said, I'm just shy of 15 weeks today, so I made it through the first trimester. Next time, I think we'll be talking about some common first trimester symptoms that women experience, and then some natural approaches that we can do to help with them. Today, I thought it'd be good to go over different supplements that women should be on during their pregnancy. The first being a prenatal. And I think most of us know that, at least when we go into our first OB appointment, they recommend a prenatal. So I always recommend a prenatal, and this is what I take, what we have at the practice. When you're looking for a good prenatal, one of the things that I recommend is that you look at, when they have the B vitamins in there, make sure they're the methylated forms. So the MTHFR, which is the methyl tetrahydrofolate reductase enzyme, a lot of people now have some sort of genetic SNP with it, which is just a process that we have an issue with methylating. So having methylated Bs will help with that, which will be important as baby grows and the DNA and things are forming like that. So the other thing that I take is a fish oil. So again, this is one that I take from my practice. There's some really good ones out there. What you'll want to look for is a good amount of DHA, not just EPA. So EPA is going to be the highest amount in your fish oil. I take 2 grams of fish oil per day, and of that, 900 milligrams are of DHA. DHA is really important for neurological support for baby. Obviously, that happens a lot in the beginning as well as in the 8th month of pregnancy, where a lot of that neurological development is going on. The other thing, again, I live in the Midwest, so a lot of us are vitamin D deficient, so I do take a vitamin D. Now, a lot of good quality prenatal vitamins will have vitamin D in it, typically about 1,000 IU per day. I do recommend that you're tested before you self-dosing the vitamin D, because vitamin D can be toxic. The other thing that I take is calcium, and I vary my dose based on what I'm getting throughout my diet. Good calcium sources in your diet are green leafy vegetables, broccoli, spinach, things like almonds also have good amount of calcium, and dairy products. Now, a lot of my patients have a dairy sensitivity, so again, we're trying to get them through other sources. But again, with being pregnant, we have extra demand for calcium in our body as well too. The last thing that I take, and it may not be an everyday thing, I usually vary it throughout the pregnancy, is a probiotic. And there's a lot of different probiotics out there, but a lot's going on during pregnancy. One, the vaginal microbiota is changing, so we have a lower diversity but higher stability of the bacterial composition that's present within the vagina. And this is protective for both mom and baby against infection, because if we have infection, we don't want, again, that affecting our pregnancy or baby as well. Now, other things that probiotics are really beneficial for is that they will help reduce incidence of gestational diabetes. They help reduce incidence of metabolic disease as well, such as for future, cardiovascular disease in baby. Also really good for the gut barrier function in baby and helping establish that, and in our gut. That's really important, not just for gut health, but also immune health as well. The other thing that it can help with is if there is autoimmune disease, especially if mom has autoimmune, it can reduce baby having an autoimmune disease by up to 50%. So to me, there's a lot of great benefits of taking a probiotic through pregnancy. And again, depending on my patient's history, we'll recommend certain strains that would be good for them if taking a probiotic at all. Again, there's other things that probiotics can help with as well. So those are just some of the supplements that I take throughout my pregnancy. Again, if you have any questions, feel free to drop some comments so we can answer them. Otherwise, like I said, next week we'll be going over some common first trimester symptoms.